In this video, I want to talk about the joints that are part of our skeletal system. Joints are basically a point of connection between two bones, and they are considered to be composed of both the bones and the connective tissues that hold those bones together. A more scientific word for joint is an articulations, articulations referring to that movement, and you actually have about 230 joints in your body, even though we don't think about all the little joints that are there. Joints allow your body to move in response to how your skeletal muscles contract and pull on the bone. And also for women, the joints allow the pelvis to expand for childbirth so that child can move out of her body. We can categorize joints by the type of connective tissue. So the first type of joint is a fibrous joint where we have dense connective tissue connecting the bones. Then there are cartilaginous joints where you have hyaline cartilage or fibrocartilage connecting the bones. And then last, the synovial joints where we have synovial membranes around a joint capsule and you have additional structures in these joints. Synovial joints are the most freely movable, so when we think about joints, really most of the time we're thinking about those synovial joints. Let's start with the fibrous joints. As I said, they're composed of dense connective tissue, and they're typically found between bones in close contact, so bones that are right next to each other. Most fibrous joints have no movement occurring at the joint, so the joint is just holding these bones together. The scientific word for no movement or joints with no movement is synarthrotic. And a good example of a fibrous joint is the joint between the bones of the skull. So here we have various joints in sort of this zigzag pattern. We call them sutures. And so holding these two bones together are going to be the dense connective tissue that makes up that fibrous joint. Fibrous joints sometimes can have limited movement, and so we have the amphiarthrotic is the word to describe a limited amount of movement in a joint. And an example of that is the membrane that holds the two bones in your lower limbs, or your leg and your lower arm together. So there is an interosseous membrane. Inter, of course, is between two things. Osseous, that word that we saw with osteoblast, it just means bone. So between the bone membrane, between the tibia and fibula, as this diagram is showing, you have a similar thing between the radius and the ulna. So connecting these two bones, we have a membrane, and so this is considered a fibrous joint. Then we have the cartilaginous joints, and they may be composed of two different types of cartilage. The first one is hyaline cartilage, which is the white, shiny kind of cartilage. An example of that is the cartilage of the ribs at the anterior end of the ribs. So the bone itself will end here. You can see there's cartilage, and there's cartilage that goes to the sternum. This joint at the sternum is a synovial joint, but the joint where the rib end hits the cartilage is a cartilaginous joint, and it's made of hyaline cartilage. There is a little bit of movement, so it's an amphiarthrotic joint on your ribs as you breathe in and out. Another type of cartilaginous joint, which is really just a temporary joint, is at the growth plate or the epiphyseal plate. And this does not have any kind of movement because, of course, it's where your bone is growing. And so we have our epiphyseal plate here, and we have new bone on one side and new bone on the other side. And just this cartilage is sort of the place where the bone is being laid down. But it is considered a joint because it is connecting two different pieces of what eventually will become one long bone. The second type of cartilaginous joint is made of fibrocartilage. And again, there is a little bit of movement or amphiarthrotic. And one example of that is your symphysis pubis, and that is the joint that connects the two bones of the pelvic girdle area, or the pelvis, connecting it in front. In the back, you're connecting to the sacrum of the vertebral column. And so this is the joint that's going to expand a little bit with childbirth for women. And then the intervertebral discs are basically a package of fibrocartilage with a gel-like elastic substance in the middle. So it's kind of, the fibrocartilage is all around the outside, and this allows movement of your spine when you are bending forward, bending backward, going from side to side. That slight movement is possible because of the cartilaginous joint between your vertebrae. But most of your joints are synovial, And synovial joints are freely movable, and they can move in multiple directions. The scientific name for that is diarthrotic. Synovial joints also have a more complex structure with a number of other moving parts besides the bone and the connective tissue. We have 6 types of synovial joints. They can be on a single axis on how they move. The hinge joint and the pivot joint are uniaxial. Can't say this today, uniaxials. They can move in 2 different directions or be biaxial, and examples of that are the saddle and the condylar joints. And then they can move in many directions or multi-axial, like our ball and socket joint and the gliding joints. So to give you some specific example of our uniaxial joints, the pivot joint is rotating around a central axis, and this is an example of the very, very top of your vertebral column where the vertebrae connect to the head. The top vertebrae is set up with your head on a pivot joint, and you can turn your head to the right and turn it to the left, and then the whole column can kind of bend forward to look at your toes, but the joint really is just moving around in a circle around this axis. Then there's the hinge joint, which moves along one plane like a door hinge, and so your elbow and your knee are perfect examples of a hinge joint. Biaxial joints, where you have 2 directions that can happen. The very base of your thumb, actually where the thumb hits the wrist, hit the carpal bones down here, we have a saddle joint, and so it's like the bone is sitting on top of a saddle on a horse, if you can think of that. Your thumb itself is going to be up here. This is kind of where your hand goes, because your metacarpals, of course, are the palm of your hand. So the saddle joint can move in 2 directions very well. The condylar joint, you have an elliptical, not a perfect ball, but sort of an oval-shaped end of one bone going into this shallow oval-shaped socket on the other side. The most common place we see that is where the bottom of the phalanges connect to the metacarpals in your hand. So your fingers can move in a couple of directions, but they're not as freely moving as the true ball and socket joint because it's just this elliptical shape. And then our multi-axial joints, the ball and socket joints of our hip and our shoulder, where you actually have a ball end going into a bowl-shaped connection, and that allows movements in a 360-degree circle motion as well as out and back. So you can move in many different axes. And then the gliding joint, which is what we have in the bones of our carpals, where basically there are a lot of flat surfaces against each other, and it allows things to sort of slide back and forth, and that allows our wrist action. So moving on to more details on the synovial joints that have all these different directions of movement, the synovial joint is basically a joint cavity that has ligaments on the outside and a synovial membrane on the inside. So it's making a joint capsule. Other parts of the synovial joint include articular cartilage, mainly hyaline cartilage on the end of the bones, synovial fluid running in between the ligaments and the membrane, providing a fluid to reduce the friction. The synovial fluid is kind of as thick as egg white, uncooked egg white. You may also have a meniscus or menisci, which are fibrocartilage pads that are in there for shock absorption, and bursa, or bursae, that's plural here, which are fluid-filled sacs that provide lubrication for tendon when it's sliding over bone to prevent any destruction of that tendon. So looking at a knee joint, a synovial joint with some of those things pointed out, we have, our femur, the big thigh bone up top, the tibia down below, we have our patella, so those are our 3 bones in our synovial joint. We have, you can see a section, they are only labeling the ligaments in the front here, the patella ligament, that patellar ligament that's going up the front. We've got some ligaments in the middle. The anterior cruciate ligament is the ACL that so many people tear while they do a twisting motion with their knee. You also have a posterior cruciate ligament, a PCL, but we don't hear about that as much. And then your synovial fluid is the kind of the gray material in here. So this is all this more liquidy stuff in your joint capsule. We have our menisci that are providing some shock absorption. These light blue pads that we see here are both menisci or menisca, and the green ones are bursa. So these are the fluid filled. You see one in front because the tendon from your quadriceps is actually, kind of in this whole area, and so that bursa is providing some protection against that tendon being broken down by the bone. You have a bursa between the tendon and the femur over here. We have another bursa down below, again, providing a place for that tendon to slide across the bone and not be torn up at all. And then we have a little bit of fat also in this joint. So there's a lot of parts in a synovial joint, and things can go wrong with various parts within that joint, causing issues for people. Some more examples of synovial joints, just to show you again. Here's a shoulder. We have the various things pointed out. We have a cadaver that has been cut open to show you the shoulder joint. And this space right here would normally be filled with synovial fluid if this was an actual person and not a living person, not a cadaver. And then again, the hip. The same sort of thing. You can see here's the top of the femur going into that ball and socket joint. It also gives you a good sense of all the different muscles that we have coming in at various directions all around. Here's the end of the pelvis, but this is all muscle tissue fibers in different directions. We have many, many muscles we don't name in the kind of the deep area of the body. We focus on muscles, typically the ones that are more superficial that we can see. We have a number of words to describe how joints move. Flexion and extension are one of the most common ones. Flexion typically is using to show a decrease in the angle of a joint. So as somebody takes their knee in this first picture and bends the knee and picks it up, the angle between the two bones of the joint gets smaller. Goes from 180 to 90 degrees as it bends, so that's flexion. And then extension, the angle is getting bigger. So if somebody went from a flexed foot down to an extended foot, they would be going from 90 degrees to 180 degrees, so the angle's getting bigger. Also, when it's not such a clear-cut angle as in a hinge joint of an elbow or knee, flexion and extension tend to be flexion towards the anterior part of the body, towards the front, and extension towards the back, as you see here with the head, and also as you see here with the body. Flexion and extension I guess you consider the hip joint would be the angle that's changing here. Other words we use for joint movement of the hand, we talk about protonation and supination, or you might hear about if you're swimming, a prone float, when you're floating on your stomach. So in protonation, the palm is down, whereas supination, the palm is up. You can also think of supination as if you were making a bowl of soup out of your hands. Not that you want to eat soup out of your hands, but that would be a bowl shape supination, like soup. And then with your foot, when you're flexing the foot, it is called dorsiflexion, and when you're pointing your foot, it is plantar flexion, because in both cases, the angles here are changing to make them slightly smaller. The last three words I want to cover are abduction, which is moving away from the midline of the body, adduction, moving towards that midline, and then circumduction, or going around. So you can have circumduction occurring because of the ball and socket joints in your shoulder and hip. Very few of your other joints will be able to do circumduction. Finally, I just want to cover some common joint disorders that you may know about or have experienced them yourself. Dislocation is the displacement of the bone. Now, you can also have some overstretching or tearing of connective tissue at the same time, but the big point, or the most important point for labeling something as a dislocation, is that the bone has moved out of the joint. When there is a sprain, you get the overstretching or tearing of the connective tissue without the bone moving out of the joint. In fact, they may go so far as to have the connective tissue pull loose from where it was attached on the bone. Bursitis is caused by overuse or continual stress on the joint, which results in an inflammation of the bursa. Tennis elbow is an example of a type of bursitis. And then there is gout, which is actually a genetic disorder where a missing enzyme causes a buildup of uric acid, and so that acid creates inflammation and pain because it is a crystal, and the body tissues do not appreciate a crystal building up in that joint. Probably the most common joint disorder over time is arthritis. Osteoarthritis is when the articular cartilage softens and disintegrates gradually with time. It typically happens just because of age, but you can also trigger arthritis by overusing a joint because you play a particular sport, or genetic factors can be part of that. So joints will become painful as bone pushes on bone instead of having that cartilage, slippery cartilage to lubricate it, which makes movement more difficult. However, continuing to move typically helps with arthritis pain. Then rheumatoid arthritis is an autoimmune disease, so the immune cells of the body are attacking the joints. They're attacking the synovial membrane for some reason, and we're not quite sure what triggers this. The membrane becomes inflamed. Often you may even have fibrous tissue going into the articular cartilage and changing the composition of the cartilage to the point where the joints may actually turn into bone. They may ossify and fuse, which then completely eliminates movement. Autoimmune damage can also occur in the heart and the blood vessels, so rheumatoid arthritis is a systemic problem, even though we maybe see the biggest effects in the joints. Then the third type of arthritis is caused by Lyme disease, which is a tick-borne disease that can have a number of systemic effects. And Lyme arthritis is characterized by intermittent arthritis attacks. It seems similar to rheumatoid arthritis, but they come and go. That's what intermittent means. Finally, just thinking about your joints over age. As you age, you can see changes in the intervertebral discs. So the fibrocartilage, that is the outside coating of those discs, will stiffen and may eventually crack or rupture. So this is what's causing a herniated or a ruptured disc. The more flexible gel-like stuff inside gets squeezed out because there is a break. The amount of break, the damage that happens to that disc will vary. It can be a very small amount and will heal on its own, or it can be a very large amount of the interior substance has come out, causing pressure on a nerve and pain and requiring surgery. You also just have a general joint stiffness and loss of flexibility as you age. Just the connective tissues do become stiffer, but you can kind of add to that and make it worse by not using them. So disuse, the move it or lose it applies to joint flexibility. If you don't use the joints, blood supply is cut back because your body's saying, oh, we don't need to send blood there because it's not being used. And so that makes things worse. So activity and exercise can keep joints functional longer. Any kind of motion, range of motion activity, whether it be something like yoga or something like lifting weights, either one of those can increase your flexibility and maintain it over time. So we have a yoga instructor here who is 96, and you can see that she still has kept her flexibility. So all is not lost. Aging makes it a little bit harder, but it's not impossible to keep your joints flexible even as you age. So that finishes what I want to cover in this overview of joints.